In our Kenya Kwanza plan, universal health coverage is a thematic area, a key result area. So to augment efforts of government at the lowest level, we want to facilitate these medical camps, free medical camps, and subsequently we are also thinking of having mobile clinics. Yeah, we can go around providing medical facilities and attention to patients from one region to another.
I want to also start by thanking Honorable Waziri and through his foundation, the Walo Foundation, for this second medical camp that we are holding in the great county of Siaya. Community diagnosis, of course, is one of the key aspects of any medical camp. It tells us the basic health problems at community level. And we do that through screening and triaging of the patients. We'll be able to come up with the number of patients seen and the commonest conditions. Of course, like in any other part of the country, non-communicable diseases are emerging as a big burden in this place, but not forgetting the existing communicable diseases. And based on that, once we have that, then we can be able to partner with the county government and other partners to be able to address some of those challenges.
We are offering different services. We are offering cervical cancer screening and prostate and breast cancer screening. We are also offering HIV testing and counseling. Besides that, we are also having gyne-oncologists. We don't just test to confirm that you are having cervical cancer. There is gynecological oncologist that is based here, Dr. Gabriel Ohuma, who also help us in making follow-up, including seeing them in other tertiary facilities like Moi Teaching and Referral Hospital. There are surgeons here who will help us identify and will be able to make follow-up for this. We have partnership with Chronic Diseases Africa, and this is helping us not only to see the patient and forget them here, but to put them in a register and monthly follow-up and ensure that they continue to get the drugs, even the periods that we don't have such kind of medical camps. They will be able to follow them up, provide them with this kind of commodities, and just making sure that they are compliant to their treatment. Besides that, we have a range of commodities that we have bought from the pharmacy, not short expiry as in most camps, through the support of Eliud Owalo Foundation and his friends and partners in this foundation.
As National Syndemic Disease Control Council, we have identified the issue of teenage pregnancies in Siaya. The level of teenage pregnancies is high here, and we are working with the Ministry of Health, Ministry of Education, the County Commissioner's Office to be able to identify the perpetrators of teenage pregnancies and to bring them to book. We are also doing health education in schools, telling the girls that the best thing to do is to focus on their education. Now, the same route that girls get teenage pregnancies is the same route that they get HIV. So Siaya County is one of the top 3 counties in Kenya in terms of HIV prevalence. And so as National Syndemic Disease Control Council, we are educating, we are reaching out to schools, primary schools, secondary schools, tertiary institutions, telling them the best ways of preventing themselves from HIV.
And that is a fundamental departure through the Eliud Owalo Foundation in our medical camps. It's not just a band-aid kind of treatment that we deal with you at that particular moment and forget about you. We have that continuum of care, including working in partnership with the county government and other hospitals to ensure that once we pick a problem that cannot be handled at this medical camp, then we follow you to the entire stretch until you get to the final level of care that you require. For example, now we are partners with the Mission Hospital here. You can see the ambulance here is from the county government, and therefore that partnership is what we want to encourage so that we don't just offer sport treatment, but care through to finality. The other key thing is that we use this platform for health education. We can be able to give health talks to the community on health behavior changes that they need to undertake. For example, now is the rainy season, as Waziri has said. We have puddles of water all over the place, grass is overgrown. Keeping clean compounds reduces the chances of mosquito breeding, the need for you to be able to boil your water, cook your food properly, disposal of waste properly, then we'll also be able to shield us from communicable diseases. So this is just but a beginning with the Eliud Owalo Foundation. We will go the whole hog in the entire region, and probably even with the partnership we have today to be able to move to the entire country to bring these services closer to the people.
We have had very many ministers. Even in the last regime, we had 3, but we never saw this kind of interaction. I'm not saying they didn't do much for our community, but this level of getting down to the grassroots was not there. That's a fact that everybody is out there. So Waziri, thank you very much. These things take a lot of sacrifice. These things take a lot of dedication to do. So this is a very big intervention.
And some of us who work for government, I think we need to give back to community. And this is part of giving back to community, and we want to thank the Oli Dowalo Foundation for doing this. And it is just the beginning. We hope to do much more.